Wait.
Oh, definitely.
Your heart now, I'll be back on the market.
Everyone, I think we're gonna start in about a couple seconds. We're just waiting for everyone to join in. Good morning, good afternoon, or good evening for our virtual folks, depending on where you're joining us from. Thank you for being here. For everyone in the room, welcome. My name is Malva Karandive. I'm the programs manager here at SID-United States, and it is my pleasure to invite you to this event sponsored and organized by Palladium. And the event is Catalyzing Social Entrepreneurs, Local Leaders Drive Impact. A little bit about SID-US before we turn it over to our speakers for today. If you're not familiar with us, we are the largest and the most active chapter of the Society for International Development, which is an international network founded in 1957 to serve as a global forum dedicated to sustainable economic, social, and we serve as a global town square for the international development community, bringing together people from diverse organizations and career stages ways. All right, I think. Great. Thank you, everyone. Apologies for the little setback, but we should be all good now. Just have one extra slide, and then I will turn it over to the speakers. All right, great. So just to continue, different ways that you can get involved with us. You can check out our events and sign up for a weekly newsletter. You can apply to be a co-chair or a work group or network associate. These are volunteer positions with us, and you get to lead work groups and be very involved in the different activities that the work groups do. You can follow us on social media. Our handle is SID-United States on all different platforms. And a few things to note for today's event. We will be recording this session, and it will be available publicly on our YouTube and other social media platforms. For everyone virtually, closed captioning is available, and you can activate it through your own individual settings. For questions, I know Rose will address this as well, but for virtual attendees, if you would like to ask any questions, please post them in the chat box, and we will try to make sure it goes to the right speaker. If we're not able to answer all questions with the interest of time, apologies in advance. And with that, I would like to turn it over to Rose Zioka from Palladium, who's going to give her opening remarks.
Thank you so much. Good morning, good afternoon, good evening, everyone, from wherever you're joining us from. My name is Rose Nzioka, the country director for Palladium in Kenya. I've been with Palladium for about 8 years now. I joined as a chief of party for a USAID project and transitioned about 4 years ago to my current role. My background is in public health and information systems, but I'm very passionate about locally led development. Actually, one of the reasons why I joined Palladium when I did was because of Palladium's commitment to empowering local leaders. And therefore, I'm really delighted to be speaking to you today. I'd like to welcome you all to today's event from wherever you're joining us from, that we are co-hosting with SID and USAID. And I would like to position our conversation today on locally led development into Palladium's broader vision for localization, private sector engagement, and inclusive growth. A couple of years ago, our co-CEO, Ricardo Michel, who you'll be meeting later in this event, together with other senior leaders in Palladium, put together a task force for localization. I serve in this task force. And what this task force did is we looked at our decades of experience in implementing locally led development. And we looked at what are some of the best practices that we have seen that have worked that can be scaled. And we documented them into a living document that we call our localization strategy that we continue to improve on and iterate as we document these best practices. This of a management team, who I'm co-chair of that team, together with my colleague, Luis Soto, who is our chief of party for a USAID project called Competitiveness Program in El Salvador. I'd like to thank a number of people that have been very instrumental in the development of this strategy. One being Anne Jorgensen, who has authored the strategy, as well as other key colleagues, including Indira, who is here, and Katie Vikland, and others, who've been very instrumental in helping us to document how Palladium has implemented localization, because localization within Palladium is how we have approached doing development. And, the Center for Technical Excellence, led by Molly Kanu. And a team of experts that sit within the Center of Technical Excellence, who are experts in localization and capacity strengthening. With our localization strategy, we are committed to fundamentally shifting how we do business within Palladium. And one of the shifts is that we are going to continually be engaging in the discourse around localization like we are doing today. We are committed to continuing modeling best practices in engaging local systems and positioning local leaders throughout the entire life cycle of implementing a project, not just at implementation, but all the way from project design to project implementation, execution, closeout. Another thing that is critical for us is creating pathways and opportunities for new local leaders and supporting local partners in performance improvement within their organization so that we can promote sustainability and resilience. And we'll be hearing a lot more about that in the talks today. These new partners that we continue to work with are not just the traditional partners that are non-profits, but include private sector partners, social enterprises, etc. And particularly, we have seen that these partners have demonstrated a lot of agility and speed in the way they execute, and they have brought a lot of innovations in various sectors, including health. For us is private sector engagement in driving forward localization. Palladium has continued to be very invested in working together with local business communities wherever we work. In 2022, we worked through 2,500 partnerships with nearly about 18,000 businesses, small businesses. Now, what this did is that it raised their incomes by nearly $700 million and created tens of thousands of jobs. And this is something that we are particularly very excited about. We can only build resilient local systems by working together to design and invest in inclusive development. The World Bank estimates that there are about 712 million people that continue to live below the poverty line. For us to sustainably be able to eradicate global poverty and also address inequity, we cannot do it through donor-funded programming alone. And that's why Palladium is sector to improve health outcomes through the nation's first social impact bond. At the same time, we also invested in small and medium enterprises in Guatemala to raise their incomes and decrease irregular migration. We also worked in Malawi with smallholder farmers to increase their incomes, increase the quality of their crops, and as well, in turn, the quality of their livelihoods. In my home country in Kenya, we worked through Kenya Investment Mechanism to spur around over $600 million invested between 2018 to 2023 in various sectors in Kenya's economy. This goes to show the power of catalyzing development through private sector investments. You'll be hearing a lot about case studies that will be showcased from our NPI EXPAND program, where we have continued to implement our localized strategies and continue to iterate them. But allow me to highlight an example from Kenya and from Eastern Africa. Recently, I did attend this event is that out of 5 organizations that NPI EXPAND has worked with in Kenya to strengthen the organizational capacity, there is an organization called CHP. I believe that's Community Health Partners. This organization has been in existence for the last 35 years by missionaries, and it has 9 health facilities in a county called Narok in Kenya. Now, what is of importance is that Narok County is one of the counties that has had the worst performing RMNCH indicators for a long time. And this community, the community in Narok County are mostly the Maasais who are marginalized, and there's been a lot of SRH challenges. Now, this organization, while working in this community for 35 years, did not have a strategic plan. And that surprised me a bit. But what was even more surprising is that throughout the period that they have done their implementation, they have been able to turn around the indicators in Narok County almost single-handedly. What NPI EXPAND did is that it invested in this organization and carried out an organizational capacity development assessment and worked with the leadership of this organization to identify, to prioritize the gaps that were identified through this assessment. One of the gaps was development of a strategic plan, development of a resource mobilization strategy, development of a governance policy and HR policy, etc. So through a series of interventions, NPI EXPAND has been able to strengthen this organization greatly. And from the words of the CEO who was speaking at the closeout event, he said that they have not been able to receive USAID funding before. NPI EXPAND was the first funding. And through the implementation of their resource mobilization strategy that they've only implemented in the last 1 year with support, able to get to be and to continue doing. So I found that really it was a proud moment for me as a Kenyan first, but also as a development professional, that because we put local leaders at the center stage of development, allowed them to prioritize what their problems were, allowed them to determine the future that they wanted for themselves. They were able to attract funding, and now they continue to improve RMNCH indicators in Narok County. You'll be hearing a lot more about examples like this, where we have worked with social enterprises to spur development. Thank you very much, and I do hope that you enjoy this webinar.
Thanks so much, Rose. I'll be very quick. My name is Samantha Lemieux. I'm a senior associate at Palladium on the NPI EXPAND project. And I just want to quickly acknowledge that we have people, thank you. We have people in person here in Washington, DC, and also online with us from around the world. For the folks joining us here in DC, we will have some coffee and a chance to network and connect with each other after the event. For our online participants, we really want to engage with you as well. I'll be monitoring the chat box and sending some questions. We really want to hear about your own experiences as development professionals, as social entrepreneurs. So please share your experiences, react to what you're hearing from our panelists, and engage with us online. Thank you. I'm going to pass it over to Cindy now. Thanks, Cindy.
So are we moving from up here?
Okay, great. All right, so good morning. Thank you, Rose. Thank you, Samantha. My name is Cindy Cizik. I'm a senior technical advisor for private sector health within global health portfolio, working for our Americas region. I am normally based in Isla Mujeres, Mexico, so a little further south in the Americas than DC, but really privileged to be here today and to support this event. So I have actually spent a good chunk of my development career supporting initiatives that were designed to engage or strengthen the role of the private sector in the provision of health products and services. And that experience really helped to my early interest in what I would say is now a passion in terms of how to design private sector initiatives or programs that really help to maximize the sustainability of those efforts. And equally important, how can we support organizations that are in that transition toward organizational, financial, and technical sustainability? So of course, I was thrilled when Jeff Barnes, who is the project director for NPI EXPAND, asked me if I'd be interested in leading a qualitative study designed to look at just that. So for those organizations that are looking to transition, what are the key enablers and what are the key barriers that they are facing in making that? So a shout out, of course, to USAID for their support and vision, Laura Wenzel, who is on the NPI EXPAND team, Jane, for your guidance and support as we implement to this study, and obviously also for Clancy Broxton. So we have your support. There are a number of health and development organizations that are now embracing social entrepreneurship models and driven work. And for many, that interest stems from for the desire to continue supporting their target audience and those vulnerable populations and underserved populations that they serve, but also in the face of decreasing external support. So the entrepreneurial shift really presents an opportunity for them to look at new ways of generating revenues, potentially increasing their financial sustainability while also continuing and growing their social impact. So the NPI EXPAND study, that organizations that were actually crowdsourced from all of you, from many different people, they basically included social marketing these organizations agreed to talk to us very candidly about their journey and about the lessons learned and challenges that they faced along the way. So I'd like to take a moment to just acknowledge those organizations. The social marketing organizations that participated were Nepal CRS Company and TMARC Tanzania, both independent social marketing organizations, as well as Population Service International's social business unit for the Latin America region, previously called PASMO, but as I understand it is now being called Via Health. The service delivery, or the organizations that focus for the most part on the delivery of health services, included Marie Stopes Ethiopia, Pro Salud Bolivia, and Sehat Kahani from Pakistan. The supply chain solution companies included Maisha Meds and M Pharma. Both are regional organizations working across multiple markets in Africa, as well as Swipe RX, which is functioning mostly in the Asia region. So we appreciate all of them taking the time to share their insights, their lessons learned. And of course, we're privileged here of Sehat Kahani, Pakistan, also serve as one of our panelists. I think it's important to underscore that within this mix of organizations, we had NGOs and nonprofits who had essentially been receiving USAID support for decades, as well as some newer social enterprise organizations that had been established within the last 10 years or even less. So today I'd like to share a couple of the cross-cutting themes that emerged just to set the stage for our panelists. The first key theme, I think, is the mindset shift. So this applies mostly to the nonprofits who had that decades of experience of working with international donors as major recipients of donor funding. And they reflected that what was critical to the success of their transition was the capability and commitment of their senior leadership teams to be able to drive that change. For that transition, many of the leaders also mentioned that that required recruiting new staff with more direct private sector experience, who could also foster a culture of innovation that they were looking to go after. So to quote one of our participants, Susana Barrios, director of Via Health, she mentioned that changing mindset was key. We had worked for 15 years with donor funding where there were strong controls to guarantee the correct use of funding, but for our commercial activities, we also needed to have control of our resources and be agile and be ready to make faster decisions. The executive director of MSI Ethiopia mentioned we had to transition the mindset of our nurses and doctors so that they believed they were running a business in order to save lives. We established strong policies to be able to measure staff performance and provided training and oversight and mentoring to our staff in order to be able to achieve that. So the second cross-cutting theme was access to capital. And I think we saw that this was well mentioned most of the participation. So one of the key challenges being faced by social organizations and social enterprises So the challenge, have a viable and scalable business solution, even when they are sometimes in the nascent stages of revenue generation. Okay. To help them modernize their diagnostics and service capabilities, and again, to remain competitive with some of the other for-profit organizations that are also offering these services. Only 2 organizations that we interviewed had actually accessed successfully private financing. And I think that this suggests that, there's still a fairly complex landscape for accessing private finance, and that remains a significant barrier to many of these organizations. So the third cross-cutting theme, being able to balance was being able to, again, find that balance between what they were trying to achieve in terms of social impact and also the journey towards financial sustainability. So while their commercial counterparts or the organizations that they're sometimes competing with can prioritize profit over mission, these social enterprises were actively working to fulfill their social mission, and striking this balance requires critical and strong governance structures as well as robust financial management systems. And I think you'll hear from some of our speakers today how they manage that balance. Finally, fourth, being ready to pivot. So despite some of these challenges, the experience of social entrepreneurial organizations highlight opportunities for innovation and impact. And by strategically shifting management and operational mindsets, organizations can position themselves for long-term success. But organizations also need to be ready to pivot when their business models are simply not working. And I think you'll also hear some very interesting case studies around that. So Na Akwete, who's Senior Vice President for Strategy and Business Development, and now actually one of the COOs for M-Pharma, mentioned, if you're going to do anything innovative, there will be, as a matter of definition, many roadblocks. You have to be comfortable pivoting instead of giving up, and think of it as an investment rather than a stumbling block. So on that note, I'd like to actually transition to our panelists for today's discussion. As I mentioned, can we present our panelists? As I mentioned, we have Dr. Sarah Said-Quran, co-founder and CEO of Sehat Kahani. We have Danielle Kayemba, who is the Chief Operations Officer for Waste Plus, Chamber CEO of ECD. So on that note, Sarah, I would like to over to you to give you.
Sure. Am I audible and visible?
You are.
Okay, perfect. Hello, everyone. It was speaker. I'll actually go through them within my journey of creating and building Sehat Kahani. So Sehat Kahani started when actually I was 5 years old. So I come from a middle-class background in Pakistan. I was told by my parents after 2 brothers that I had that I had to become a doctor. And from that day onwards, the only dream in my life that I saw was to become a doctor. I went into my medical college at the age of 18. I saw that 90% was also made up of women. And that was the men in universities, but not women. So it was surprising for me, but I understood after being in the medical college for a few years, why my parents wanted me so desperately to become a doctor, and why all those women landed in countries very noble family or can't afford an education. The first thing they want their daughters to become is a doctor. So if you get into a medical college being a woman, you reach the top of the social stature. So all my medical college, I saw women coming into the college and getting graduated. But as I reached the final years of medical college, I saw a very interesting thing that a lot of them started to get married and having children and actually stopped considering to be a doctor. So for them, being a doctor was only a way to get married into a good family and to have a stability in life and have a social stature and be noble. But actually, a lot of them did not think of practicing after marriage. A lot of them were forced to give up practicing after marriage, again, due to social cultural barriers. This in Pakistan is a very interesting phenomena called the Dr. Bride phenomena. And if I match it with numbers, Pakistan has 240,000 doctors and we're a population of 240 million people. So we have 1 doctor for 1,000 patients, which is half the lowest WHO standard. But because so many are women, And out of 240,000 doctors, 80% are women, and 40% of these never practice. We miss a whole lot of working doctors from the medical workforce ecosystem. So in actuality, in Pakistan, the doctor-patient mismatch is half a doctor to 1,000 patients. And when I landed in my last year of medical college in a tertiary care hospital, I realized that what impact does it have on the patients? So a lot of patients in Pakistan's biggest tertiary care hospital came to be managed but not treated. So they came with issues that could have been managed at a primary care level, but in their community, because of the doctor bride phenomena that we have, that creates a doctor-patient mismatch, their diseases eventually progressed from primary to secondary to tertiary care, and they were brought to the hospital in the end when their family could not manage them at home or in their communities. Now that really created a mismatch in my head and a huge irony, where so many doctors are not working and so many patients are not getting healthcare. When I graduated, I also became a doctor bride. I got married right after my graduation. I started my residency in radiology, but I had to quit after a year because I got pregnant, and they didn't allow me to continue my residency. So in the time when I was pregnant with my first daughter, I started doing a primary care clinic in a slum. And women doctors also don't go in slums, so that was a rarity. But I was really interested to do primary care because for what I've seen in the tertiary care hospital. So I started going every day and doing consultations for the community. And I realized that my being there made an actual difference for that community, particularly for the women and children, because they were able to see a doctor rather than seeing a quack or a midwife or a nurse. After 9 months, I moved to a separate city and I had to quit that clinic as well. And when I landed in the next city, which is Lahore, if any of you know, Lahore is the second biggest city of Pakistan. I landed in a house with a 1-month-old daughter and I couldn't work anymore. So I actually at that time and I went into postpartum depression. At that time, the nurse from my clinic, which used to work under me, called me and she said, we can't find a doctor to replace you. So on her request, I started doing on-call consultations in that clinic. So I was sitting in Lahore and the patient was in Karachi, and there is a 1,000-mile distance between the cities. And I'm doing consultations on call, and we later switched to video calls because the patients had to see me, to trust me to be able to provide care. And that just gave me that concept that if I, being a female doctor, can provide consultations from home, why can't we create a network of women doctors in the country that can provide consultations online? And that created the idea of Sehat Kahani. Sehat Kahani means story of health in Urdu, in my native language. So the idea was to change the story of healthcare written in Pakistan using Sehat Kahani. So it's a chat, audio, video, digital consultation platform that allows women doctors across the country to connect to patients online and provide quality and affordable healthcare using technology. We also connect the patients to pharmacies, labs, and tertiary care referrals. When I initially started Sehat Kahani, I started with the concept of a social enterprise, which is one of the areas of the research as well, which is an enterprise that creates impact and sustains itself, but necessarily does not create profit enough to grow as a commercial company. So I started creating clinics in low-income areas where we place nurses physically, and when a patient walked in, the nurse connected the patient to an online doctor. And these were all in remote areas where communities did not have access to physical doctors. I did this for 2 years and the clinic started to grow. When we reached 11 clinics, I realized that my circumference of impact was very limited because I was only employing 2 doctors kilometer from the clinic. But in the actual population, I also want empowering the 80,000 doctors that were sitting at home. In this time, I went into INSEAD and I learned the term impact business, which is a business that creates impact, but also generates revenue to reach profitability and scale. And coming back, we decided to create a commercial vertical, which will not only sustain our clinics, but also increase our impact and our scale. So after 2 years of creating clinics in low-income areas, we actually transitioned into an impact business and created an app for the urban market. And this app did everything that the clinics did, but without the nurse. So a patient could download the application and connect to a doctor online. At this point, we were also able to raise funding for the application in our clinics as well. So we raised our first seed round of funding and we made the app. Now, when we made the app, application, it didn't work because in Pakistan, healthcare was still very physical. That COVID happened. And when COVID happened, the country went into a lockdown. And Sehat Kahani app was chosen by the government of Pakistan because it was the only telemedicine application that provided consultations online and within the platform. So Sehat Kahani application became very popular in COVID. People started downloading it and using it in lockdown. And today, as our journey has grown, Sehat Kahani has become one of the leading digital healthcare platforms in the country. We have our clinical vertical that has grown to 63 clinics in remote areas. It is the largest telemedicine clinic solution in the country. Our mobile application is primarily used by corporates as a part of their insurance for corporate employee wellness for themselves and their families, for GP care, for specialist care, for mental health care and well-being. It is also used by consumers at an individual level. That includes subscription plans, pay-as-you-go models, and home health care as well. We also raised subsequently a pre-series A round and a series A round. And along with that, we also kept raising soft funding. Now we have impacted around 3.1 million patients in Pakistan. And we have created a network of 7,500 doctors, out of which 90% are women, and 40% are those that we have brought back after a break. A few things that I want to share in my journey that I think were very, very pivotal in creating the success and sustainability that Sehat Kahani has created today. The first thing that we did was we were two doctors who were creating it. So we always valued quality as our main strength rather than technology. Technology was an enabler, but we really made sure that the quality of doctors providing consultation was supreme. So we created an OLP, an online learning management solution for doctors, so that they can train themselves on the platform and keep upgrading their service. We also did not spend a lot of money on marketing. We did a lot of partnerships, and we did partnerships at all levels, from government to corporates to NGOs. We today have around 860 corporates who use Sehat Kahani application, and around 70 to 80 other partners who are working with us on different things. So partnerships are crucial with us in creating that impact. A lot of people ask me, why did you convert from a social enterprise to an impact model? Why did you create a commercial vertical? A lot of people think that we might have deviated from our purpose of providing impact. But I believe that my purpose from the day one was to democratize healthcare access for all in the country. And by creating two verticals in which one piggybacks on the other, we've been able to triple or quadruple our impact over the years. We also have this habit of constantly pivoting. So we don't really sit on one model, but we keep finding different models that would work for our clients, whether it's our corporates, our consumers, or our clinics. We also spend a lot of time in the last 4 years in figuring out a unit economic, because I realize that if our unit economic don't work, nothing will work, even in the clinics, as well as in our for-profit model. So even our clinics break even in 12 months and less, because we have calculated the price we need per patient in that clinic per month that we need to create sustainability. We also invested a lot in our team. So my real strength of what we do today and where we've reached today is a team of 70 to 80 people that we've really developed over the years. We also invested a lot of time in creating regulation because in Pakistan, there was no telemedicine regulation. So we created the first draft of the telemedicine policy, which is also under review. I'm really glad to share my journey today because doing the study, I think it had all the elements of what Sehat Kahani has actually been through in practicality. And I'm so happy to share that journey with you today. Thank you.
Thank you so much, Sarah.
Examples of strategizing. So thank you again, Sarah. Now we're going to move on to our next speaker outside of the health sector. If you can change the slide. And Daniel, are you with us? Daniel was having some video issues earlier, but hopefully. Okay. Great. Over to you, Daniel.
Thank you so much. I'm really excited to be part of the team. I'm co-founder, also chief of such a good big audience to listen to the story of waste, especially plastic recycling, down from Uganda, East Africa. So I started my journey from the campus, from the university, when I was studying about environmental sciences, especially in conservation biology. From there, I got a I got in the love of plastic recycling because of my community, which was really choked up by plastic, especially by the community which stay around the Lake Victoria, and they were suffering from malaria and other problems from plastic pollution. So I got in a group of people who believed in what our cause. Then we got in a friend from UK. Then we started a project called Eco Bricks, which was recycling waste plastic. But then this time around, they were just crushing and selling to the middlemen, especially the Chinese, who are taking it out of the country to make more product out of it. But then during my university times, we had some models which could help recycle the plastic in-house or within the community to create more good products like the bricks. We used to make a lot of lumber out of the plastics. So we introduced the concept to him, and he really enjoyed the project because it made a really big difference from the linear way of recycling, get the plastic from the environment, crush it, then sell it to the market, to get the plastic, recycle it, create a product, then sell it to the market, especially in the local areas we were staying. For 3 years, it was really successful because we managed to have more than 6,000 people who are directly benefiting from the project, and also enabled us to collect more than 27 million bottles from the environment, which was really important onto our side. That's when we met. We were joined by youth employment, and to help from the engagement, especially with the training which were so much carried out by the Palladium group and also other groups of people who used to train us on how to set up our own projects. Then that's when I broke off from EcoBricks to start on my own venture. Where I was working with EcoBricks, it was Masaka, which is around 300 kilometers south of the country, south of the capital. So I moved on from the rural area to start my own venture in the capital, Kampala. So starting off as a young person who has a big dream of transforming their community, I will discuss the critical role of access to funds and business advisory services in empowering social enterprises, and using West Plus, which is the social business venture I opened up as a case study. So West Plus was established with a clear mission to tackle waste plastics and also try to create jobs for the young people who are really very many on the street without jobs, because more than 80% of the young people in Uganda are earning below $1 per day, are surviving below $1 per day, which is really a big problem to us. And yet, in the same space in Uganda, the plastic pollution is way too much, because every day we dispose of more than 600 tons of waste plastic, and less than 9% is collected. That is according to World Bank. So there is a lot of big problem of waste plastics, but also a very, very big problem of youth unemployment. So we started West Plus to add on value onto the waste, especially the plastic, and also create innovation around it, which could easily be taken to the market. So by focusing on plastic recycling and waste management, Waste Plastic did not only address environmental challenges, but also play a significant role in the social and economic environmental challenges, but also quite a significant social benefits for the local communities. To date, Waste Plus has recycled thousands of tons of plastics and generated employment opportunities and improved health through the cleaner environment. So as I told you, Kampala is on the edge of Victoria, so there are very many problems associated to that, especially when it rains. There's a lot of flooding which happens, and this is majorly caused by the plastics which get in the trenches and also in the yards of people. So we try to create a project West Plus, which was focusing on creating hubs for women and vulnerable communities. How are we doing this? We used to, or we try to give them necessary materials to start recycling. Then for us, we get plastics from the recycled plastics from them. Then we put them in our extrusion machines or our equipment to have the final products, which has been working out very well. In the recent few months, since the inception of the project, we've set up close to 9 incubation centers, and these are some of the places which are collecting the plastics. And also for us, what we always do is to recycle it. But then going back in the early stages of West Plus, we faced a significant financial challenge, especially traditional options, which were really very limited. You either have to go to the bank, or you have to write it to a donor, or go to the government. All these options are not easy for someone who is starting up, especially because one, going to a donor, they will first to ask your credibility and also the feasibility that your project can work. And then they give you some money, which is not so much, but also still keep monitoring to see that at least you do something out of it. Yet most of the young people down here in Africa, they don't have the capacity. They have the dream, but they don't have the capacity to do their work fully, which is quite a challenge. Working with the government is full of bureaucracies, and also a lot of paperwork is involved, which is quite difficult for someone who is starting up. And also the last one will be going for a loan. Again, still looks for bureaucracy and security, which is not easy. So what West Plus did, we teamed up with we wrote proposals, then moved out to different people, asking them to finance our project, which was not easy still. So we found a friend of ours who was from the US, and he believed in our dream. He told us, hey, if you want to be successful, I can help you achieve this by at least giving you some of the money to help you start and see where you can go. Then you can see how best we can work together in this kind of field. So that was really important to us because it was a blessing for our startup. And it was equally important for what we wanted because, I mean, we wanted a lot of money, but then we from, which was really a step ahead. So equally, it was important. Business advisory services in any startup is very important because it has access to business sustainability. West Plus struggled with strategic planning and business management because one of the key aspects is that recycling is not a very old venture here in Uganda, especially in West Plastic. I mean, in West Plastic recycling. It's a very new, and those who know it, they know it at a very high level. And most of the people who are in the business are the Chinese, who are given tax holidays, who are given free resources, and yet the nationals do not have the same privileges. So it's really very, very difficult. So through advisory services, our organization developed a clear business model and strategic plan. For example, on how to collect the plastic, we had to set up those hubs in different areas, then worked out with the local council to make sure we get enough material in case we wanted to. Then capacity building in areas of financial management has been very key, and marketing with operational efficiency, which was significant in improving West Plus's internal capacities and capabilities. Moreover, advisory services facilitated in the networking opportunities, especially with the people whom we worked with in the previous projects and wanted to give us a hand to push on our work. So in recent, we've worked with the Embassy of Netherlands to showcase our work and the exhibitions, and also other partners, especially those ones who are dealing in agriculture, who have given us a platform to showcase our work in their projects. So it has been very important for us to work out with different groups of people, especially like the embassies, the schools, the church. How are we supposed to work with the church? So we worked, we talked to the priests and used their parishes or their prayer centers as collection centers for our plastic. This enabled us to increase on our collection capacity and also be sure that at least every time we shall have enough stock. Because most of the times, people in Uganda, they believe in the church. And when the priest told the people, please bring your plastic here, we can collect it from here, they really rushed to do that because they believe in the priest is a man of God, you know. Then, two, we worked with schools where we had a project called Plastic. Where we talk to parents to collect for money for children to get their school requirements. That enabled us to collect more than 13 tons of plastic in less than 3 months, and also benefits of recycling in their communities and everywhere. That was really very, very, very important for us. Then this has helped us really to change our model and also get very many organizations would like to partner with us because they see what we are doing is really tangible, and also is an employment, creativity, inclusion, especially working with the PWDs who have been working also plastic for us. So they love to come and support a particular cause. So when you want to access funds, we try to understand our model and also know that the one size fits all approach done here. But first, understand the communities you have to find a certain recommendation. In the broader,
Can you wrap up in the next 30 seconds?
Sure. So what you're seeing there what you're seeing there on the screen, those are some of the products we've made. The chair with the laptop here is one of the products we made. Then we made a picnic table. We worked with women, and very many other products we made, especially within the plastic recycling systems. So it was really important, and also having whatever you wanted, but first defining our model was very important. Thank you so much, Steve, for the opportunity availed unto me to have this wonderful group of people to talk to and understand, push them to our gospel and our model to them. Thank you so much.
Thank you, Danielle. Very inspiring story of a social entrepreneur who has managed a generation for youth and women. So congratulations to us.
Yes, I'm still here.
Yes.
Can you hear me?
Can we share Tracy's slides? Go ahead, Tracy.
Hi, good afternoon or good morning, everybody. Tracy Chambers from Cape Town, South Africa. And I'm going to introduce myself really as a serial social entrepreneur. Found my way into the social entrepreneurship space in a sense, in optimization and working a lot within the fast fashion retail sector. I've started several social enterprises under the banner of an organization called Taking Care of Business. But today we're going to focus specifically on with Palladium and USAID through the Catalyze program, which really aims to bring private capital into the early learning sector, and they're doing this in a number of countries. So our mission as Grow is really so that every child has the opportunity from a young age to develop and be set up for success in their schooling years and beyond. And we do that by essentially having developed initially a franchise model for early learning centers, where we developed the complete recipe book for a woman who had started an early learning center that would be more considered a daycare center, where she was looking after children, but not necessarily understanding how important education was. And she didn't have the resources and the skills to provide the 5-star early learning that we believe every child has. And I'm really going to focus on my learnings as a social entrepreneur in general, in terms of bringing, local African solutions that work at the base of the pyramid. The first through action. I think, I've seen over the years many academics, myself, recent years developing business and doesn't work the same in these environments. Particularly when we tech solutions. Grow EC has developed a fully integrated mobile early links, and before that was my natural laying down good processes. So whilst you want to be agile, and you want to try out things, you need to continuously, right from the start, be thinking about scale and how do you lay down those solid foundations, because that really we think like a business, and by being able to respond to funders' needs, whether it's from a finance point of view or an M&E, and respond in a way that makes their lives easier, and it builds trust, and therefore that opens doors to further opportunities. I think my personal struggle in the world of social impact is balancing business sustainability and impact. I think particularly organizations that have come from being a non-profit first and really out of necessity having to become more financially sustainable. It really is, it's an internal struggle, a daily internal struggle. The other challenge that we face often is that you're actually stuck in no man's land to some degree. On the one hand, you're competing with nonprofits that are giving away services for free, products or services for free. And on the other hand, you might be competing with big business that has lots of capital, better efficiencies and better margin, and is able to produce a product that's better than yours. And somewhere in the middle, you find yourself. And so often I've seen so many individuals who come into the sector with an impact first lens, out of necessity, actually have to move into a market that is not actually the impact market. And we were faced with the same challenges in Grow ECD. We have a model to wealthy, but it the mission that that you set out on, but actually you and at Taking Care of Business, we do that very effectively. So we don't fundraise per se, but we tell the story of impact, and the funding follows, whether that is grant capital or other forms of capital. It follows because people are confident that we have the data to support our claims and the stories that actually they are able to tell themselves in terms of how their capital was deployed for impact. So those are really some of the lessons that I just wanted to share with you. Thank you so much for having us. We really do appreciate being able to share our learnings with you.
Great, thank you so much, Tracy. I really love your self-introduction as a serial social entrepreneur. I love that, and I think you talked a lot about the importance of one of our key themes, which is, you know, being able to manage that balance between maintaining the mission, maintaining your goal, and struggling with the financial performance and how to do that. So as our last speaker, I would like very much to introduce Ricardo Michel, who is co-CEO of Palladium, responsible for co-leading Palladium's global business. Our US government and commercial clients, and overseeing prior to being in the law